something that we really never taken our eye off the ball, if you will, but are making a very strong push with lately, as a lot of folks know, surrounds mental health here in New Hampshire, for adults, for children, for our entire population. I'd like to provide an update on some of the steps that the state has taken just in the past few weeks, primarily in addressing the ruling made by the New Hampshire Supreme Court, which really created an opportunity for the state to, I think, double down on our efforts and go extremely fast. We kind of say talk is cheap. Action really is what produces results, and the team has really stepped up and responded in a very unprecedented way, which has been wonderful. We know that there have been barriers to mental health services. They've existed for years. I think over the past 3 or 4 years, we've made some huge strides, to be sure, but unfortunately some of those barriers were exacerbated by the pandemic. So with the combination of the court case and what we saw out of the pandemic, some of the opportunities to invest in mental health out of the federal funds that are coming into the state, as well as some of the state programs that we already have. A lot of things are coming together to create opportunity for our citizens. So first and foremost, I think some of the initial things that we are looking at, the idea of having new private providers come into the state to help our existing system. We have a good infrastructure here, but allowing more of private providers, some new types of workforce around mental health. There's been barriers to that, and we're really opening that door. I'm just a big believer that if somebody can provide a good service and they want to be here, well, then we're going to open the door and again, provide that opportunity for our citizens. Really making sure folks understand that in just the past couple weeks since that Supreme Court decision came down, we have been able to come into compliance in just a couple weeks, primarily around the probable cause hearings and the evaluations that really come of that, through a judicial process. But those probable cause hearings, which were at the heart of the case with the Supreme Court, we've been able to come into compliance very, very quickly there. And hats off to the team at both New Hampshire Hospital, some of the members of Commissioner Shibinette's staff, everyone putting in a lot of extra hours to make sure that we didn't just check a box and get it done, but really move very, very quickly to make sure that we were responding to the needs of the citizens. And then a lot of new rules for licensing, for treatment, for discharge. All of these things, again, just being designed to break down some of those old barriers that had existed for years, really leaving no stone unturned. On top of that becomes investment, and we do have some investment opportunities. So the number's a little, we don't know exactly how much, but it could be as much as $100 million into mental health here in the state of New Hampshire. And you'll see by the slide next to me, there's a variety of things that we're looking at. And this is just a kind of a first blush a little bit at some of the initial stuff that we're already well underway with. Not ideas, actually happening as we speak. New DRF beds, 30 new DRF beds that hospitals are kind of transforming some of their beds in a more community setting to DRF beds with the stipends that Commissioner Shibinette has put out. About 60 new community transitional housing beds within the next 6 months. And that's really at least 6 beds in all 10 counties, making sure that they're community-driven opportunities so folks don't just have to rely on a single hub out of Concord or Manchester, making sure that there's opportunity in everybody's backyard. We have 40, at least over the next few months, about 40 long-term care community beds coming online. So these are long-term care facilities that are taking some of our geriatric psych patients from New Hampshire Hospital and providing treatment and services right there in a long-term care setting back again in a more community-based setting. So huge opportunity there. And the state is providing funds and incentives to do that as well. We are moving forward. The forensic hospital I've been talking about for years, we're going forward. We're not letting anything hold us back, and so that is well underway, and again, that will provide a lot of flexibility both at the community but especially at the state level. Our community mental health centers getting their rates up and on parity with some of the other private providers across the state. That's something that has been battled and negotiated for years, but really increasing those rates to make sure that they that have the tools and what they need to provide those community-based mental health services. And the new mobile crisis teams, that process is also already underway, again, to provide better treatment in home. So I know that's a lot, but again, this is just what we've gotten done in the past couple weeks. And so I think the sky's the limit in terms of opportunities, in terms of ideas that we're bringing to the table. We just want folks to know that we're leaving no stone unturned. There are going to be bumps in the roads. We know that this isn't an end-all, be-all solution, but this really is the most transformative action on mental health the state has ever taken, and it's happening very, very rapidly. So we're going to keep our heads down and nose to the grindstone, as they say, and keep working it.